I'm going to go ahead and get started. I'm Anthony. I'm Anthony Morici. Been with Ambetter for about 4 years or so. So if anybody has any questions or anything, my card's in front. We're also doing a raffle for these bags. So once the presentation's over, there's like an Ambetter hat, Ambetter hydro flask inside. So everybody go ahead and leave your business cards, and we'll go ahead and raffle it off. So we'll go ahead and get started. So today we're going to primarily kind of just focus on Florida since we're down here, but obviously there's a lot of information for the other states that's available. We can always share that with you as well. So just to go through the typical Ambetter overview, I'm sure everybody's probably seen this slide before. Ambetter is right now the #1 marketplace product across the country. We have over 4.3 million members with about 1 million or more members here in the state of Florida. So right now, 1 in 7 shoppers that have an ACA plan have one with Ambetter. Ambetter is offered by Centene Corporation. So for those of you that aren't familiar, Centene is the parent company of Ambetter. We're their specific ACA product. And right now, Centene is number 22 on the Fortune 500. So Centene itself has been in the managed care industry for over 30 years. So although Ambetter has only been a product for about 12, 13 years or so, Centene, our parent company, has been around for double that, going about 30 years now. So here's what's new for 2025. So one big thing I would say is going to be the name of our core plan, or our bronze, silver, gold, our most broad network that we have in Florida, and that's in all of our states. That's now going to be called the Premier Network. So just keep that in mind. You're going to start seeing Premier Network rather than core. And that's just going to mean that's our most broad network. That's the network where you don't need referrals. You can see anybody, specialists, PCPs. We're also going to have some condition-specific plans this year for diabetes. So keep your eyes open for that. You'll see a specific plan that's catered towards the diabetic population. We're also going to be expanding into Martin County for 2025. So in Florida, we're expanding only into 1 county. Nationally, we're going to be expanding into Iowa this year. So that's the one new state that Ambetter will be entering. Is it statewide? Statewide. And statewide in Iowa. So anybody here that wants to sell in Iowa or already does, let your reps know. We're going to be starting contracting already for Iowa. So you can go ahead and get that done before we get to open enrollment. Renewal letters, those are going to now be available in the broker portal. So I know we've had that question a lot of years. CMS, Ambetter, we send out the renewal letters every year for members, letting them know what their new premium is going to be for 2025. That's now going to be in your broker portal. So you could see the exact letter that we're sending out to members. So when they're calling you, you'll be able to see the same letter that they're looking at on the other side of the phone. Big thing too, I think, is Ambetter in Florida now. We're not going to be having Sunshine Health. It's just going to say specifically Ambetter Health. So make it a lot easier for providers, for different people to recognize the brand. I know Sunshine does various things like Medicare, Medicaid, and people get confused a little bit sometimes by the brand. So a lot easier this year. It's going to just say Ambetter Health. Like I mentioned, core plan is going to now be called Premier. And then another big thing is the AVA, or the virtual access plans. We're getting rid of those in 2025, so we're no longer going to offer those plans going into the next year. Here's a quick look at our county coverage for Florida. All of this we'll have available as well afterwards, so we could always share the presentation with you if you want anything from here. You just see pretty much black is going to be all the counties, orange is going to be where we also offer a value plan, and then the pink county, Martin with the asterisk, that's going to be the one new county we're entering. We have coverage maps like this for all of our states, so if anybody needs access to a different state, let us know. We can always send that out to you. And here's a quick look at the Premier portfolio. Very similar to what we offer. The only difference is really going to be that it's not called the core plan anymore. So you still don't need any referrals. You could still use this in every Ambetter county, every Ambetter network. It still gives you access to having any buy-ups for adult, vision, and dental. And then here's kind of a look at what our provider network highlight looks like. So this is a quick overview on some of the main hospitals that we have throughout the different counties here in Florida. You could see probably the biggest addition so far is going to be we've added Lee Memorial in the Fort Myers area. That's the newest addition in terms of the bigger highlight network. Still operating through Orlando Health primarily in Orlando, U of Health Shands in the Jacksonville area, Advent still our main partner in Tampa, amongst others. And we obviously have a larger list of providers, so if anybody wants access to the full guide, we can always send that out too. So pretty much anything you need, we'll send it out to you after the presentation. Off-exchange plans, we're still going to continue to offer those. One thing to keep in mind with off-exchange, you have to go through the Ambetter portal to take a look at these. I know a lot of people are used to using Sherpa or going straight through healthcare.gov. To see our off-exchange plans, you got to go directly through the Ambetter broker portal. And it's very simple. That box comes up. It'll ask you, do you want to qualify for financial assistance, which means you're going to go through the marketplace. If not, you could go directly through us, and we're not collecting any information like they do for the marketplace plan. So if you ever have a member that's not interested in going through the marketplace, off-exchange is definitely a good idea. The plans are the same, the network's the same. There's really nothing different besides that you're not going to be getting subsidies. Here's 4 things that we rely on to kind of maintain our partnership with agents and agencies. Obviously, number 1 important is always going to be competitive commissions on new and renewed members. So in most of our markets, we're probably number 1, if not number 2, maybe for commission. Every account gets a knowledgeable account executive. That would be somebody like myself. So pretty much what we can help out with are Ambetter sales types of questions, things like what's in our network, what are the plan designs, where can you go for specific things. So I can't always help with everything, but your account executive could at least point you to the right direction within Ambetter. We also have a separate support team. So besides the sales executives, we have a support team that handles the kind of day-to-days. So if you're ever calling into Ambetter with commission questions or portal questions, that's the team you're speaking to. Every agent also gets their own broker portal. So everybody has the ability to manage their book of business. There's a bunch of materials in there that I'll get into down in the presentation. But it's definitely something that I know a lot of agents like to give us suggestions, things like that for the portal, and a lot of them that we've implemented come from some of the agent suggestions. Community impact, so something important for Ambetter is obviously being involved in the community, whether it's us volunteering or just our regular community involvement team. Ambetter is very involved being out in the community, doing different things for various organizations that we partner with. So definitely keep your eyes open. I'm sure you'll see some type of Ambetter representation at the events that your guys are participating in. So just a quick overview into the broker portal. Hopefully everybody here that has an Ambetter contract already has been into their broker portal. This is what it's going to look like when you log in. You'll be able to see how many members you have, how many haven't made their payments yet, how many payments are delinquent, or people that are maybe getting close to having their membership canceled. Once you go into the policy information, you can do a lot of things. Sort it in here yourself, whether it's based on their name, date of birth. The easiest thing to do is you can download it into an Excel. So if you ever want to take a look at your book of business, it's really easy to get into Excel and filter it based on location, how much they owe, things like that. So I always advise, before open enrollment, go in here, download your book of business. Sometimes the broker portal, when open enrollment starts, can get a little wonky with so much data. So if you download it first, you'll have access to all your members. You won't have to even go onto the internet. It's always a safety valve. But once you go into the policy tab, this is some of the information you can see on your members. So you can find out what their actual responsibility is, what the premium is versus their tax credit. A big thing now is it shows you whether they're enrolled in My Health Pays. So My Health Pays is our rewards program. I think it's probably less than 20% of our members have it, but those that have it renew at like a 67% better rate than regular members. So you can see right here, easy point to touch on your members, let them know, hey, are you enrolled? Get them enrolled, and I'm going to go into how that program works later on and kind of the benefits that come with it. You can also see their dependents, print their ID cards, and now we also have auto pay available, which I'll show you guys in a second. But just similar, just goes into detail, delinquencies, unpaid, what date they're paid through, and then just remember that we're always a month behind, so if your member enrolled for May, you're not going to see that on a commission statement until at least June. So just kind of keep that in mind as you start to enroll people throughout the year. Some of the other options we have in here, also quick pay, so you can make one-time payments as well as set up auto pay. This is where you would get access to that off-exchange enrollment tool or enroll a client now. You can also, if you don't want to go through ambetterhealth.com and you're in your portal, you can also find a provider with a quick click on that link. Within there too, there's a lot of resources like I was talking about, some of the different forms we have. We have state-specific training material, state-specific marketing material. So if you're doing social media ads Facebook ads. There's a ton of already made images in your broker portal. There's blank spaces for you to put your agent information or your contact information. So there's some that are built for Instagram, Facebook, where they're just little squares. We also have the actual flyers you could print out yourself if you're going to be doing any in-person events, and you can obviously download the PDF versions and post them too. If you're ever looking for like an Ambetter logo or you want to use something specifically on your website, you can always reach out to us and we can get you that set up as long as you provide us a draft of what you're looking to do. Some new features, like I mentioned, we're going to have the renewal letters. So those will start to be available in November. So right after they get sent out to members, we're going to start uploading them into the broker portal. Also, you now have the option to make auto pay for, right now it's about 9 states. We're working on getting the rest of them added in by open enrollment. But you can go in there, set up auto pay. It gives you access to see what cards they're set up on, if their payments were taking out. So I know a lot of agents are already using it. If you're not, definitely make sure you're setting up auto pay. Helps you a lot. Make sure commissions gets paid every month for everybody. It gives you a lot of insight too, a little bit more than what you see in the regular portal. When you have them set up on auto pay, it's a different system, so you can see a lot more into their billing and what they're getting sent out to them. So here's a quick overview on the Premier portfolio. So just a reminder again, this is the core portfolio right now. It's being switched over to Premier. Same exact names for everything. You could still see the Elite Silver, Focus Silver, Standard Silver. Obviously, the newest addition is going to be the Enhanced Diabetes Plan. Here's kind of the main plan we have, the Focus Silver. This is our lowest cost silver plan that includes copays. We just have a comparison here based on the different AV percentage levels. You can tell all of them have copays built in for their PCP, specialists, labs, generic and preferred drugs, as well as urgent care. Second most popular, probably going to be the Standard Silver. So this has a $0 deductible, $0 PCP for those at the 94% level. Also has different copays built in. The only difference is there's a co-insurance for labs rather than a copay. I know we get that question a lot, so if you want someone that wants a copay for their labs, definitely would be the Focus Silver. And then there's just a quick comparison on them. So those are 2 most popular plans. You see not too much of a big difference in the max out-of-pocket or the copays. And then once again, we'll have this available for you guys in the portal and we can send it out to you. The one thing we want to touch on is going to be our Everyday Gold plan. So you could see it has a relatively low deductible. They also have copays built in for your PCP, specialist, for the lab. This is probably going to be popular. What we've kind of seen is going to be in the Broward, some of the Palm Beach area where we might not have a low-cost silver. We do have a very competitive gold plan. So we just want to make sure we call that out. The majority of the state, the Premier plan, that's going to be our lowest cost plan, but there are going to be some areas where the gold or Everyday Gold might have a slight advantage. Then I know we get a ton of questions throughout the year on adult, vision, and dental. So this is pretty much the basic version of what the vision plan costs. If you're ever looking for this, it's not located in the summary of benefits for some reason, but it is in the Ambetter broker portal. So if you go into your broker portal, under training materials, there's a vision and dental folder that has the benefits for both the vision and the dental plan. So no waiting periods for vision. You see you get a $0 copay on a routine eye exam every year. You get to pick whether you want glasses or contacts, which you get 100% covered. And this also operates through the Evolve network. So if you go on our website, type in vision, it's going to take you out to another website that gives you access to our full provider list for those that are in our vision network. Same thing with dental, no waiting period. They're only available as add-ons, so I know we get that question a lot. We don't sell this as a standalone product. You can only add it on to your health insurance if you have one with Ambetter. Very simple type of plan, 50% co-insurance on most of the minor and major restorative care, and then $0 copays on those routine cleanings and oral exams. And then just to make sure coverage applies only to in-network providers, so you definitely want to make sure your members confirming with their provider that they're going to accept our plan before they go in. So some of our Ambetter Health member benefits, this is going to be pretty much what comes included with all of our plans. So obviously the comprehensive major medical, we offer My Health Pays and Rewards programs. We have different medical management programs, so people that have chronic illnesses or things they're dealing with, we will set them up with different programs that usually have to be initiated by their PCP. So if you have anybody that has a chronic condition and they're new to Ambetter, definitely make sure you get them in to see their doctor so that we can get information up to date on them and get them set up on any program that they require. We have copays for all virtual urgent care, which includes mental and behavioral health, and then obviously no exclusions for any pre-existing conditions. One thing that I don't think a lot of agents are too familiar with is our Abenity program. So aside from My Health Pays, we have a partnership with Abenity. They're pretty much like a members discount program. So if you have anybody that goes to different gyms or they're interested, maybe like in nutrition classes, things like that, they offer discount programs for them. Even for home gym equipment, you can get stuff for like a weight set at home. So a little bit different than My Health Pays, where this actually gets them access to discounts on things they can go out and buy, and maybe for things that they're already using. Just make sure that you go through the website to set it up. If you go straight through Abenity and don't connect your Ambetter portal, then it might not work for them the same way. Teledoc, we're going to be offering that. So we don't have the AVA plans, but we're still going to be having everything powered through Teledoc. So this is something where members can access non-emergency issues through pretty much virtual care 24/7. It's going to connect them with somebody throughout the country. So if they get somebody outside of their state, let them know that's not an issue. It's still covered. Teledoc just will give them whoever's closest that's available at the time. Really easy for those that are kind of in rural areas, maybe that have a different type of work schedule. But same thing, we have this powered right through the member portal. If they go through, get logged in, it'll set them up with their policy number and everything. Just make sure the same thing, if your member's using Teledoc, they have to put in their Ambetter information. We've had members that use it, didn't connect their insurance, and then they're getting billed regularly. So just make sure they're inputting their Ambetter policy information. But something great that a lot of members take advantage of. My Health Pays program we've had now for a while. I'm sure many of you are familiar. Members can earn up to $500 throughout the year. That's going to be able to help them pay for different things like co-pays, different premiums, obviously, is what we want to focus on. But very easy program. You get points for doing things like a survey, going to your PCP wellness exam, and a lot of things throughout the year. It is pretty much an incentive to help members stay healthy, stay active, and actually use their policy throughout the year. They can access the rewards program, and you actually have to sign up for it through the portal. So that's one thing. If you've been an Ambetter broker for a long time, we used to automatically enroll members so that everybody that signed up with Ambetter, as soon as they did something that triggered the rewards, they were in. Now you have to opt in to the program. So if you aren't a part of the rewards now, the member has to go into their portal, actually sign up to be a part of the rewards program. The good part about that is once they sign up, it tells them exactly what they have to do, and they could probably knock out a couple of things right away. But obviously, it's getting that extra step of making sure they go into the portal and sign up. But once they do have it, they're able to use those points. They can shop or use them on our online reward store. You can convert the points. So just like any point system you guys use, they get points. They go into the portal. They could use those to buy things or convert them into dollars. Those that want to convert them into dollars, they get sent that Visa card on the bottom. So if your member ever gets sent one of those, it is legit. It's our rewards program. And most likely they had to opt in or sign up for it, or they had done it in the past. And one thing is that it does roll over year to year. So if you have a member that's with us now and they renew for next year and they have a balance on My Health Pays, it'll roll over with them to the next year. So a really good sales tool. If they have $300 or $400 now, their premium goes up by $1 or $2. They pretty much already have the money to pay for the next year. So that's why those that actually use it end up staying with us a lot longer than those that don't. So just a few quick call outs on the member portal. Very similar to kind of what you see in the broker portal, except for obviously it's going to be specific to that member. They can go in there and change their PCP. So if they don't want to spend an hour trying to call people and figure out how to get a change of the PCP, they can do that directly through their portal. They can get access to all of their claims. They can download their ID card. And they can also, like I said, get access to telehealth. And then big thing too, it calls out their plan. So let them know, it's going to let them know exactly right here what plan they're in, if they're enrolled, what's their status is. So if they've missed any payments, it'll obviously change to an inactive rather than an active enrollment. Since something brand new for 2025 and something that we've already started to roll out is an Ambetter app. So I'm sure maybe some of you guys have already seen this. It's already available to most members out there that have a smartphone. And they can do a lot of the same things that they're doing through their portal, but just directly right through their phone. We are setting up different push notifications, so things to let members know, hey, you're renewing, hey, opt into this. Same thing with like My Health Pays. They're gonna have the ability to look right here to see where they stand with their deductible, with their current max out of pocket. They can also download their ID card straight to their phone. So if they have an Apple or a Samsung wallet and they have the portal, really easy. They won't have to wait for their ID card to come in through the mail. And they can also set themselves up on auto pay too. And like I said, same thing, calling out some of the selecting a new PCP. We also upload a lot of the frequently asked questions throughout the year. So the questions that come in through the member services that are coming in through agents. A good example would be during COVID, we would update pretty much every other month the type of questions we're getting. Where do I go to get an exam? How do I cover it? So a lot of that information that comes out throughout the year, we upload into the different portals. Then a quick highlight just on ambetterhealth.com. So we get the question a lot of where can my members find out where to go to the doctor? That would be guide.ambetterhealth.com. For the most accurate results, we always tell members log in. It'll automatically tie the search to the network that they're in. If you're just searching as an agent, you can go ahead. It'll give you the option to not search as a member, but guide.ambetterhealth.com. Going into the next year, you always want to make sure you're selecting the right coverage year. As we kind of start to turn the page in October, you want to make sure that you're hitting 2024 to give you the most up-to-date network provider list. It gives you the ability to look through county and kind of select where you want to go. This year, it's obviously going to say Premier Network instead of Bronze, Silver, Gold. And then we're no longer going to have Select either, so you won't see the Select Network either. But once you do go in and search, there's usually pre-populated results. You could see under the first box up top, it says primary care provider. When you start typing in there, it's usually better to select the preset options that they have in there for you. It'll give you a little more accurate of a pull if you put doctor and select what they have versus typing in a certain type of prompt. But once you go on there, it's going to show you the doctor's information, their phone number, if they offer virtual visits. One thing to keep in mind, just because they offer virtual visits doesn't mean that it's through Teladoc. That might just be through their own virtual platform, whatever they're using. So don't assume that's going to be a $0 copay if they have that on there. You just want to ask them what they're using, make sure that it aligns with what you're doing. We provide other details in there for the provider. So things like, do they have other office locations? Is there somewhere else that your member can see them at? What languages they speak? We even have different certifications that they have, where they went to school. So if you have a member that has those types of questions, you can always get access to them. And we also provide their MPI. So similar to how an agent has an MPN, so does a provider. You can always do an in-depth Google search if you want and see kind of a little bit more about them than what we're offering right here on the portal. And then lastly would just be our formulary. So formulary stays relatively the same from year to year. There are differences. When you're looking for it, it's going to be right on ambetterhealth.com. You hit for members at the top of the page. There's the drug coverage box. Once you go in there, you'll see, we'll have it updated for next year. It'll be the 2025 formulary. We have it in English, Spanish now, and I'm not sure, there might be a couple other languages coming. But once you get into that document, it's really long, probably like 1,000 pages or something like that. We don't have the time to read through all of it. But you can always hit Control F if you're on Windows or Command F if you're on Apple. That gives you the ability to just search the prescription up that you're looking for. Hit Enter. It'll show you how many times it's on there if we cover it. If you don't see it at all, it means that it's not covered on the formulary. So pretty simple, straightforward. But I know that's something we get a lot. And that's it. So we're done with the presentation. Thank you, guys.